Fantastic. Thank you so much, Emily. Oh, good afternoon, everyone. So pleased to have you in our session today. We have an amazing group of speakers. My name is Suzanne Neighbor with the Center for Active Design, and I will be moderating and facilitating in any way that I can. And I also especially want to thank the APA Diversity Committee for hosting this conference. It's always probably my favorite conference I go to every year, and y'all are pulling it out even during a pandemic, which is incredibly impressive. So for those of you who are kind of new to this conversation today, we're going to be talking about New York City's Active Design Guidelines, which were originally published in 2010 and was a very influential document. It was one of the first publications that took very vigorous public health research and translated it into a tool that was inspiring and useful to folks like us who are working in design and development, planning, community organizing, really showing that the work we do in our built environment is impactful to our health. At this point in time, you know, the original Active Design Guidelines were very focused on physical activity and chronic disease, and we've seen a surge in new ideas, new research, so much happening on the ground. And I have to say in 2020, we have a greater sense of urgency around this work than ever before. We know about impacting our mental health, our social connections, equity, social justice. Like, there's a lot that we're pulling in. And we're very excited to be talking about how folks on this call are contributing to updating the publication, and we'll be releasing a new version next year. So we have Josh Langham from the Health Department. We have Nupur Chaudhary from the New York State Health Foundation, who's generously supporting the Active Design Guidelines update. We have Kizzy Charles Guzman from the New York City Mayor's Office of Sustainability, and we have Delma Palma from NYCHA. And what we'll be doing today is I'm going to give each of these folks a time to just kind of talk and share what role they're playing in this work, and kind of have some reflection on how we can really elevate equity in our work as we update the Active Design Guidelines. And then after each session, what I'd like to do, I'm going to populate the chat with some questions that I encourage everyone in the room to respond to, because we really see this as a moment to do some idea gathering as well. So with that, I'm going to turn it over to Josh Langham from the Health Department, and his amazing team is, you know, really powering through a pandemic, but also managing to spearhead the Active Design Guidelines update work at the city level. So, Josh.
All right, thank you, Suzanne. So I'm going to try to share a couple slides here. Let's see. All right, can everybody see this?
Yep.
Yeah?
Good.
Okay, great. Cool, so I'm going to breeze through these first couple slides because Suzanne covered some of it. So again, hello everybody, I'm Josh Langham. I'm the Assistant Director of the Active Design Program at the New York City Health Department. So I'll be talking a little bit about the update to the Active Design Guidelines, what we're sort of calling Active Design 2.0 this morning. So I'm just going to do a quick sort of background and origin. Again, Suzanne sort of covered this in her opening remarks, but it's been about 10 years since the original Active Design Guidelines were published. So again, there was sort of a pioneering publication that really connected the built environment and public health outcomes. It was a citywide effort along with some private and nonprofit sectors that really put the Active Design Guidelines together. Again, it's grounded in evidence and research, really the health evidence, and this might have been one of the first publications that really had the research and the evidence base connecting health outcomes with the design of the built environment. It's also backed by an executive order signed by Mayor Bloomberg right at the end of his administration that really said that, you know, city agencies should consider active design strategies as they build and design any sort of capital projects. And it's also, in its 10 years, really had a global reach and influence. You know, it's been downloaded probably over a quarter million times, and, you know, reached almost all the countries around the globe. So key concepts from the original ADGs, you know, active transportation, ensuring that people have bike lanes and ability to walk, active recreation spaces, you know, parks and open space that really allow people to be active, active buildings, you know, encouraging stair use, encouraging movement throughout the day within buildings, and then of course, healthy food access as well, ensuring that people have the right facilities, grocery stores, and other things in their neighborhoods and in their buildings that they can eat a healthy diet. So a couple successes in the last 10 years. There's been some stair bills really looking at the building code in New York City that allows for access to stairwells, hold open devices and fire stairs so it's visibility in and out. Zoning for bicycle parking, so ensuring that buildings over a certain number of units really are required to have bicycle parking, and as well as large commercial office spaces need to have a bicycle parking plan. And then design standards, for privately owned public spaces, which is a city planning program that really makes sure that buildings who are allowed to build taller, certainly in Midtown and sometimes in Brooklyn, are designing open spaces. And then some signature initiatives that include active design strategies, Vision Zero, safe places for people to walk and bike, the Fresh program, which encourages grocery store use, and then the Schoolyards to Playground program, which is really building upon the Walk to a Park initiative by the Parks Department to ensure, at least 85% of New Yorkers are within walking distance of a park. So those are just a few examples of how active design has been included in the city so far. So for now, I'm going to talk about the vision for ADG 2.0. It's really thinking about whole person health. As Suzanne mentioned, the original guidelines were really focused on physical activity and really through the aspect of obesity prevention, diabetes prevention, and those types of things. But I think we've realized, and I'll get into this a little bit, that the research is much broader now, and we really have a better understanding of how the built environment and the design of the built environment really impacts other aspects of health. And as well, we took this opportunity to think about applying a health equity lens, who has access to what in the city, as well as the racial justice lens. The way our cities are built really has some racial institutional racism built in. So how do we undo that? How do we talk about those in the guidelines? So the vision for ADG 2.0 is really, design guidelines that holistically promote physical activity, again, mental health, social cohesion, public safety, civic trust, and again, equity. So the proposed outline is similar to the original ADGs, where we talk about urban design strategies and guidelines, building design strategies, synergies with other sort of initiatives such as the green movement, sustainability. But what's really unique about this, the new update for the ADG 2.0, is really about community engagement. How are we engaging communities to make sure that we're designing for the people in the neighborhoods, for the building occupants? How are we really ensuring that we're understanding who we're building for? And again, we don't want to reinvent the wheel here, so we really want to build upon the work that has happened across the city in the last 10 years, so alignment with current city initiatives. Others that are on the panel today have put together guidelines that we really want to build upon: social resiliency, connected communities that Delma will probably talk about. So how do we sort of support this, since the ADGs are backed by sort of an executive order? So how do we sort of elevate that? And again, the uptick in research in the last 10 years has been sort of astronomical, as you can see from these charts. And we really wanted to dive into that research, and from the health department, certainly, about the health impacts that go beyond physical activity. So what is the research saying about mental health? What is it saying about social cohesion, and how we can really include communities in that process? So this is just, sort of a chart that really talks about the connection between mental, social, and physical health. And how we're sort of thinking about the guidelines, how all of these health outcomes are going to be interwoven throughout. So this is how the research findings have organized themselves. So enhanced connections to nature, I think biophilia, ensuring people have views of nature, is really sort of the most research that we have, and it really does have impacts on mental health, anxiety, and stress. User comfort, really ensuring that people are comfortable in their spaces, daylighting those things. Celebrating community and culture, and ensuring that we're designing with a place in mind, high quality gathering spaces, and enhanced perceptions of safety. So that's both within buildings as well as streetscapes, so adequate lighting and those types of things. So the new part that I think that sort of ties all of the panelists in today is sort of this idea of community engagement. How do we think about community engagement differently? How do we ensure that we're engaging the community members throughout the entire process, from design development all the way through maintenance and and sort of stewardship of the spaces that we're building. So we know from research, community engagement can help bolster perceptions of neighborhood social cohesion. So people, they feel that they belong to their community, and therefore really take pride. And that helps with maintenance. It helps with really people feeling safe and comfortable in their neighborhood, in their building, or in their home. And so at DOH, we really tried to think about this from an equity standpoint, of course, and a racial justice standpoint. So we've developed a community engagement framework that we hope to integrate into ADG 2.0. So, key takeaways, really understand the communities that you're serving. So we want to be able to put in the ADG 2.0 sort of strategies and guidelines about how to do that effectively, recognize that structural racism creates challenges for communities, so really acknowledging it explicitly when you're talking to communities and really trying to understand how to undo those barriers. Of course, it's not an easy task. Of course, and tap into the expertise of the communities. The people who live there are the experts in their own spaces, and build and maintain trusted relationships, of course, and ongoing. You can't just build something and leave. It has to be an ongoing thing. And so again, the Race to Justice initiative at DOH, this is an internal initiative to help staff learn how their work can better address racial health gaps and improve health outcomes for all New Yorkers. And of course, the built environment has a lot to do with that. So, DOH really wants to be a leader for city agencies, and we really want to work with other groups and think about how we can apply a racial justice lens to the work that the city does in general across the board. And then language use, how we're even talking about health outcomes, how we're talking about community members, using inclusive language and using language that everybody understands. So, this is a technical guide in some ways, but we also want this to be accessible to community members so they can advocate for themselves, that, the strategies that are in ADG 2.0, the city should be held accountable to really uphold those design strategies so that we're building a more equitable city. And so far, we've been at this for about 2 years now. We hope to have a new publication out by hopefully the end of or mid 2021, but with the pandemic, it's making things go a little bit slower. But we've engaged hundreds of people, 20 or so city agency partners, nonprofit groups. And so, these are the outcomes that have come through it. So welcome inclusive spaces, make equity a top priority, and enhance community engagement efforts. And then, of course, evaluation and measure project impacts at the end. So I will stop there. I'm sure I went over time, but if there are any questions, I'm happy to answer
I think
those.
So a couple things that I want to do right now, Josh, I think there was definitely resonance around this notion of thinking about our language and being really mindful of that. And I do want to say your team is doing an amazing job. You have 400 peer-reviewed journal articles pulled. You're doing that analysis and synthesis, and which is really fantastic. But I have a question in the chat that I want to pitch to the audience as a whole. While we know that this is going to be founded on evidence and really rigorous peer-reviewed literature, I'd also love to make sure that it resonates with a broad cross-section of users, practitioner advocates like ourselves, high-level policymakers, folks working at the community organizing level to kind of manifest what they want to see in their neighborhood. And so for here, I wanted to just make a note. We'd love to hear from folks in the room, in your own words, what makes a community healthy. And I'll be capturing some of this information and making sure we integrate it into the guidelines. And I just wanted to share one question that came up, and I thought this was very prescient. It's I should have mentioned this right at the top of the session. Lucy asks, what opportunities are there to consider how practices and policy for maintenance and operation can contribute to positive health outcomes? And I will say, there's a lot of opportunity there. We're digging into a lot of research on that front, and you can definitely expect to see that not only are we expanding beyond the word active to be much more holistic and all-encompassing, we're also expanding upon the word design to really think also about how do we maintain our assets of our buildings and public spaces, and how do we activate places, and how do we make sure that the decisions that are made in the built environment are directly driven by the needs and priorities of community members. So with that, I want to make sure we keep the conversation moving, and I'm excited to pass it over to Nooper, who's very generously working with the New York State Health Foundation to fund this work, and I'm hoping she can offer some insights on, why this update, why now, who are we trying to serve with this work?
Sure, most definitely. So can I just get a thumbs up? Can you guys hear me? Okay, you guys can hear me. Great. So as Suzanne mentioned, I'm Nupur Chowdhury. For the next month, I'll be a program officer at the New York State Health Foundation. And then after that, who knows? But, you know, the foundation for the past 6 years has been funding this initiative called the Building Healthy Communities Initiative, right? And so it's been looking across the state at opportunities to invest deeply in communities around active living and healthy eating. So I came in about 1 year into this initiative, and as we knew about a year ago that we were sunsetting this initiative and I would be departing from the foundation, I really thought about like, what was the legacy with this work and what was needed, and like really having that desire to really give a gift to the field, right? So this update for the city and this update for the active design guidelines, it sits within this puzzle piece for the foundation with another grant that we gave to the Regional Plan Association. I saw Malin puttering around the conference yesterday, so I don't know if he's here today, but Malin Mehta is the manager for that initiative that's looking at the state of New York State's health across the state. And so if you think about it, it's like the active design guidelines is looking at the city, and then the Regional Plan Association is thinking about health across the state. So I was thinking about like what those gifts were that we wanted to give to the field, even though the priority area and this initiative was ending, but also the desire that I had to leave accountability measures in place, given the fact that, you know, this is going to be the largest political turnover in New York City. If you combine both the council, the mayor, what have you, and what are the things that need to be in place so that we can hold government accountable around the vision that we see for neighborhoods, right? And the importance of having those documents updated so that communities are protected regardless of those in power, right? I'm thinking about like, you know, why does this matter on the ground? So many of you who know me know that I've been working in partnership with folks in Brownsville, Brooklyn for over a decade now. My work as a public health urbanist is grounded in the work that we get to do together there. And Emily De Los Santos, who's also in this room, worked very closely with me in Brownsville. And it's been a huge partnership for many, many years. And when I was there as a coordinator on the ground, the active design guidelines like 10 years ago was the tool that I used to knock on city agencies' doors and say, you agreed to do this, and so why am I not seeing this in Brownsville, right? So having that as a tool in my hand, working side by side with community members and having something that we could hold government accountable was how we were able to kind of really kickstart a lot of the projects that you see now in Brownsville. And wanting to make sure that even though foundations' priorities may change or, you know, like initiatives might change, that these documents can be updated and really be strong and hold weight regardless of what happens to those in power. And so there's that piece of it, but there's also kind of this vision that I had that I think the Center for Active Design does a really good job of, that we've seen over the past 10 years, of the guidelines being a tool to really be leveraged worldwide, right? So how can New York City work in solidarity with cities across the country and then cities across the world to say, we were able to do this in New York City and you can do this in Niagara Falls, which is one of the other grantees that I work really closely with. We can do this in New York City, so you can do this in Minnesota, right? Or you can do this in Mumbai, right? And thinking about what it looks like for cities to be in solidarity with each other and take the wins that we were getting from New York City to be able to spread that benefit across the world, right? So that's everything from like equitable access to parks, safe and updated sidewalks, places to be in public and to feel safe in public space, right? So like that list goes on. And so I'll stop there. I can give specific examples right now, Suzanne, or if you want, I can wait because I think there's a lot of questions that are coming up in the chat box.
No, the chat has been busy. So I just wanted to highlight a couple of things. First of all, I'm very thrilled to see Commissioner Silver here offering some ideas and really pointing to the value of Parks Friends groups and the Community Parks Initiative. And that is particularly an initiative we will want to feature in this update to the active design guidelines. I see some resources being shared, including from folks who are talking about like how to There's a plainlanguage.gov guidelines and a Hemingway app if you wanted to kind of tailor your own language and make it as accessible as possible. And as we're working on writing this document, we will definitely be using those resources. Regarding the question about, what do people see, how do people envision a healthy community? I've heard love for the places and people in your community, integrating health decisions into all the health considerations into all decision making. And Nooper, if you want to kind of hold off on your examples, I'm going to actually pitch it out to the audience first. So one of the things we're hoping to do, I'm going to put this in the chat, that we're going to be sharing some neighborhood-driven success stories that hopefully will inspire larger systems change. So I have a question here of like, do you know of a project or initiative like Community Parks Initiative that should be featured in the guidelines? And I also have a link to a call for project. We set up a Google form here at the Center for Active Design so we can start to capture more images and ideas that way. So feel free to, of course, use the call for project. Of course, just kind of chat some ideas in here as well. I know Nooper has such a rich experience, and we can come back to her as time permits throughout the session, and she has like insights on literally everything. She's an amazing coach for all things built environment related. But for now, I'd like to turn it over to Kizzy, who is going to talk about something that we've been chatting about this since kind of we started strategizing active design guidelines a year ago. That we really need to be connecting health and resiliency priorities, and they go hand in hand, and there's a lot of ways these two areas can work together. So you all can keep ideas coming in the chat, and I'm going to pass it over to Kizzy to share her thoughts.
Thank you. I hope everybody can hear me okay. Thumbs up, yes. Great, well, so good afternoon, everybody. Thanks for having me. Again, my name is Kizzy. I work for the New York City Mayor's Office of Sustainability. I want to take a moment to really thank the Diversity Committee of APS New York Metro Chapter, because they really work so tirelessly to make and create this important space for equity-focused discussion and reflection. And to everybody who is here in this session, my gosh, thank you for choosing to share this time with us. I think we're all really excited about the outcomes of the conversations you've been having since yesterday in the context of this workshop. So thanks for making time for this work. Kudos to you. Look, my work in city government, whether it was in air quality 15 years ago or climate or sustainability, has always focused on trying to translate the best available climate and environmental and social science so we can develop policies and programs, but most importantly, so we can advocate for capital projects and investments that address New York City's needs. So my teams, and I want to shout out to Daphne, who's on the audience, who's awesome and has been taking a lead on this active design guidelines conversation. They've always done work that center redressing the effects of systemic inequality and racism. And we do that by targeting the work in historically underserved and underinvested communities. I do this work because I went to high school and I still live in Crown Heights, Brooklyn, in the 90s. And the environmental quality of life that we enjoy in my community today took years of advocacy and investment. So I just want to share some thoughts on how physical and social infrastructure can help or can actually hinder communities, and why we need guidelines that bake sustainability and resiliency into the plans we're developing today. We are planning now for a changing climate, where climate impacts like longer heat waves and more severe storms are also being felt today. So what we need to be planning for actually is healthy communities, and we should be planning to do less harm with our existing infrastructure. But first, some context. When if we saw a New York City thermal imagery map, you would see cooler areas like our parks and open spaces, and you would see much warmer areas, such as our airports and highly dense places. So what we know is that in New York City, key drivers of heat impact would be things like traffic and infrastructure and waste heat sources like industrial sites. It's really clear that neighborhood and building characteristics make heat-related risk worse for some populations. And the New York City Panel on Climate Change is projecting that by the 2050s, the number of days in New York City above 90 degrees will triple. So we're facing a warmer and wetter future climate with more extreme events of all kinds. And the thing is that in New York City, like in many other parts of the country, extreme heat is a present danger, not a future risk. Because indoor temperatures can be up to 20 degrees higher than outdoor temperatures if you don't have an air conditioner, New York City actually sees about 130 direct and indirect heat-related deaths. and about 600 emergency department visits and hospitalizations every summer. Now look, each of those deaths was preventable. And so we have had the impetus to develop a plan that had health and racial equity at its core. That plan was called Cool Neighborhoods NYC, which is the city's first ever strategy to address the impacts of rising temperatures and heat waves. So I'm gonna let you Google that and find it online. But the one thing I wanna share about this plan is that it targets $106 million in city investments to heat vulnerable, historically underserved communities. And since we launched it, our Parks Department has been planting trees strategically along city streets and small parks, again, targeting heat vulnerable neighborhoods such as the South Bronx and Northern Manhattan and Central Brooklyn. Of course, the benefits of these greening strategies go well beyond mitigating heat and relieving heat stress and increasing shade, providing food corridors. In fact, there are many social and health co-benefits of community greening efforts. And to a point that Josh made earlier, an enhanced perception of safety, so that during heat waves, people actually seek respite outside of their homes instead of baking in their apartments is a good example of such benefits. I also quickly want to highlight our Cool Roofs program, because as part of Cool Neighborhoods, the roof coatings in heat vulnerable areas are prioritized and outreach to buildings is targeted there, so we can achieve clusters of light colored surfaces that reduce heat building gain, energy consumption, and waste heat from air conditioners. And the program has been made completely free for buildings that serve a nonprofit, affordable housing, or community or social service function. So the city has focused outreach there. And again, the idea is to concentrate as many roofs as possible in the geographies where we would see the greatest public health and environmental impacts. Now, buildings are responsible for 2/3 of the New York City's greenhouse gas emissions. So the last plug I'll make about our work is that we have enacted legislation, local laws 92 and 94, which require all new buildings and those with that are undergoing major roof renovations to be covered with solar panels, green roofs, or a combination of the two. And that means that New York City may actually now have the most comprehensive sustainable roofing policy in the world. So look, a takeaway I want to leave with this group is that it is critical to design projects to withstand future climate conditions and to ensure public safety. We want to design for passive and cooling of buildings so that they can remain habitable even during times of crisis. And rezoning, urban design, planning efforts should always try to maximize greening and community assets, social infrastructure that serve to foster connectedness and active living. These are decisions that we are making, right? Professionals, community-based organizations, residents that are advocating for these changes. So what I want to focus on is that from the beginning, the explicit intent of our developments and our program should be to use health, racial, and climate data to achieve health and climate equity goals. I think it's super important that we use health equity as a foundation, not as a co-benefit of urban planning and urban design. So I'll stop there. I know that was long.
Amazing. No, thank you so much. Those are so fantastic. I feel like, let me just get that transcript and use it for a nice intro someplace in the guidelines. That was lovely. Thank you, Kizzy. I also think you touched upon some really important topics. Number one, the importance of greening and biophilia in terms of impacting all aspects of health. You know, we're supporting our climate resiliency, but we're also supporting our mental health, our social connections, obviously our physical well-being. There was a question in the chat that I just wanted to highlight because I think that also, it starts to tie into Delma's remarks as well, that this notion of green building is often seen as an exclusive kind of luxury benefit. And what we are starting to recognize is that investing in green building is, particularly in low-income communities, it's a major public health boon. You're actually going to see a greater impact in communities that have been underinvested in terms of kind of green and efficient practices. So I think this is really important for us to be talking about today on this call. So thank you. And thank you for the remarks as well in the chat. So I'm going to go ahead and toss it over to Delma now, who is doing amazing work at NYCHA, has an incredible new resource to share, and probably will pop up another question in the chat if folks want to respond as well. Delma, do you want to
Great, thank you. Yes, and thank you, Kizzy. I mean, everything you're talking about and doing, also in partnership with NYCHA, is really incredible work and exactly kind of why we want to get this group of folks together to be able to coordinate those types of things and project updates like the ADG. So Yes, as Susan said, I'm Delma. I work at the New York City Housing Authority, and I always like to give a little bit of background on NYCHA just in case folks don't know about it, and because I think it sets up the conversation for a lot of the strategy we have undertaken in terms of how we do community engagement and capital projects at NYCHA. So NYCHA is the largest housing authority in North America. We house over 500,000 New Yorkers across all 5 boroughs. And we primarily house, I believe it's about 90% of our population is Black and Latinx. And the majority of those are also seniors and children. So we're talking about the most vulnerable New Yorkers. So we really embed equity, in everything that we do. That's a lens that is paramount in our work. But then kind of the other side of NYCHA that you see is the policy and planning and the historic disinvestment that NYCHA is confronted with. So as of now, we have a $40 billion capital deficit. And that's important to talk about because it is an example, a living, breathing example of what Josh mentioned in the structural racism and planning and policy that we need to undo now and be very kind of intentional about undoing. And so one of the ways NYCHA is doing that is through the Connected Communities Initiative, which is an urban design and community engagement initiative to help better connect folks, but really deal with a lot of the things that the AGG will cover in its update and the work that the folks on this call are doing as well. And so 3 main pieces about the initiative that I think we should highlight are first of all, participatory design, and that's something, city noises, but participatory design is something that a lot of folks are doing, whether those are agencies or community-based organizations. And so that is important work, and it's the work that's close to the ground and in the field, and really helps kind of involve, particularly with NYCHA, communities that haven't been involved in planning processes before. And so there's a variety of strategies that can be taken to do that, and I think they all have to be very thoughtful when approaching them, because we talk about engagement fatigue, and that is a very real thing. So one of the big pluses about this conference, but also about a lot of this work, is that it really coalesces these initiatives and this work because we all have very similar goals, and we can bring them to communities with clear messaging, and also kind of minimize the bandwidth that people need to provide and the time that they need to relinquish to these efforts, because people have a lot of other challenges to deal with, and I think that being thoughtful of that and mindful of that is important. The second piece is partnerships. All of this work is done in partnership with a variety of folks, and I wanted to highlight a couple of partnerships that I think are key to the work that NYCHA is moving forward. And one of them is actually with the Parks Department and with the Walk to a Parks initiative, and NYCHA really working with parks on how to increase equity across the city, green space equity. And NYCHA has a huge asset that is land. And in some places where land and green space is no longer publicly available, NYCHA is able to partner with parks to create these additional assets and improve access of green space to these communities. Another one is one we're doing with the Mayor's Office of Criminal Justice and the Center for Court Innovation to target crime at our 15 highest crime sites and do urban design, participatory design, and programming at these places to try to decrease the crime in these areas. And the reason this is also tied together is because we know the stress that crime, and particularly chronic, trauma of these things has on low-income communities. And if we can mitigate that through these types of placekeeping projects, that can have a huge impact down the line. The third piece is really centering community design in large institutions like NYCHA, because that is similar to what we were discussing before, a legacy building approach. I think I'm so excited by the update to the guidelines because they have that backing of the executive order, but they also unify all of these public entities towards a common goal. And instituting that at each agency is in and of itself its own big effort. And so we're doing that at NYCHA by actually standardizing the process by which we engage communities on every capital project. And so it might not sound like a lot, but it's a big lift for an agency that has 11,000 employees, and to really strategically plan, how do we do that? How do we budget for it in the long term? How do we allow the time to do that? Because this is stuff that has to be planned years in advance, and to be able to do it appropriately and to build the trust over those years is extremely important. And then I'll close with the Connected Communities Guidebook, which is the publication we released in May. Unfortunately, we weren't able to celebrate it in person, but we are trying to do a lot of outreach around it now. And so please contact me if you are interested in the book and actually getting a physical copy. We have plenty, but it focuses on community engagement, urban design, and new construction infill, similarly to the active design guidelines update, but particularly in public housing developments, where sometimes the typology can look a lot different than it does typically in New York City blocks. And so I'm happy to talk more about that, but I'll close there for now.
Right. Thank you so much, Delma. I love your remarks as well. Thank you for kind of just parsing it out so beautifully. There's so many things we can talk about. I'm seeing a lot of different ideas in the chat.
Susan,
Newport, do you want to jump in?
Yeah, I wanted to pull something out, Delma, of what you were talking about and kind of thread the needle of the power of the guidelines. So Delma, you had mentioned the initiative public housing developments, working with the Center for Court Innovation. What the name of that initiative is?
So Mayor's Action Plan, and yeah, for neighborhood safety at these 15 sites. And I think it's been going on for probably more than I've been at NYCHA, so 4 or 5 years now.
Right, so threading the needle around that, I just want to just lift this up. So the partner that you're working with is the Center for Court Innovation, right? And a lot of the work that we did in Brownsville, we did in partnership with the Center for Court Innovation. And initially when the Center for Court Innovation on the ground there, known as the Brownsville Community Justice Center, came to the neighborhood, they were very, very adamant on being public and being in public space, right? So like if you've ever worked with CCI, you know that every neighborhood has their own color. So in Brownsville, it's purple. So you will see a sea of purple sweatshirts or a sea of purple t-shirts. And 10 years ago, when we were utilizing the active design guidelines, we were working in partnership with them to think through what space looked like in Brownsville, and also using the guidelines to understand what space could look like in Brownsville, right? And that was really a leverage that then the organization could say, like, this actually is directly in line with some of the initiatives and some of the goals that we're trying to see for this neighborhood, that then really instigated and kind of really was kind of the fire starter behind a lot of the space activation that they were doing, that then garnered a lot of city support, that then meant that they were the right partner for the MAP project. And the reason why I want to highlight that is because we need to be thinking about the long game, right? So that was a conversation that we were having in a specific neighborhood 10 years ago, right? And now, the MAP project, Delma, you're saying it's about 4 or 5 years. We need to be thinking about what that long game is, right? And it's everything from who are we as an organization, who are we as an individual, how do we show up in that space, but also how does our role change throughout that time so that we can start liberating communities shoulder to shoulder, utilizing tools and accountability measures as it evolves. So Suzanne, I hope you don't mind that I just jumped in there, but I thought that was a very, very important thing that shows why it's important to have these accountability measures, why it's important to have these guidelines in place, and why things like executive orders matter, and why they're important to have kind of a little bit of meat behind the bones of a book of guidelines.
Amazing, thank you. And I think what you and Delma both pointed to is this importance of the kind of local community capacity building and participatory design. It shouldn't be engagement fatigue if it's really coming from the community and not a top-down, engagement process, but more of a kind of flexible and iterative collaboration. And I'm wondering if, I think you all can probably give examples from your own work about how that type of collaboration is can be so meaningful. And I know Josh can also talk about some of the research in terms of how that type of community collaboration and capacity building is so essential from a health standpoint as well. If anybody wants to jump in on that topic.
Yeah, I mean, I can just say, you know, from the research that we've done and also the placemaking, placekeeping project that my team has undertaken over the last 3 or 4 years, it's really, you know, understanding the current engagement efforts that are going on in communities and then actually trying to show results. And so like the placekeeping process can help do that. So, and then also demonstrate that there are city processes where you can implement projects and it's not part of the long-term 10 to 20 year sort of long game, but also what are the immediate changes that we're seeing? How can I build capacity and demonstrate that change is possible in this community and change can come from the ideas that come from community members. And then, you know, just from the research standpoint, that does build some of the social cohesion. It does start to build a little bit of trust between city agencies, nonprofit groups, and community members that we are actually making change. And then, you know, that, you know, leads to, you know, the health outcomes of, you know, people are utilizing public space. People feel safer in public space. So the mental health can increase and improve. So from that standpoint, that's sort of where the research is trending towards. And also maintenance and stewardship, people start to care a little bit more if they're involved in the change that happens.
I think we lost Selma, hopefully just temporarily. Izzy or Newport, did you want to jump in?
I actually just have a quick addition to that, which is, you know, when we talk about engagement on these design and community planning projects, we always think about community residents and engaging them. And that is wonderful. I would also just really encourage us to think through the many, like the thousands of city workers, man, like state workers, federal workers who are out here having a perspective and having tools to bring to bear to what truly equitable planning could be like. Right. So one example for that is we have a timeline, we have a process, or we're developing a process. We have a goal to retrofit our existing buildings, right, to be able to achieve our carbon and greenhouse gas emissions reduction goals. But if it's up to the folks at DCAS, or if it's up to the folks at HPD, or the folks at any other agency, right, they're seeing just a pipeline of buildings. Maybe some of us have a perspective, right, that up through other criteria and through other parameters, we can prioritize some of those buildings and move them to the front of the line so that those investments can happen and bring community benefits a bit sooner. And so that doesn't mean you don't engage the community. I just mean also there's a community of practice just right here in this room. You know, I'm thinking about the Parks Department and how thoughtful a process they undertook for the Community Parks Initiative. Again, is data-driven decision-making that allows us to say, here are the places where we're going to put this $1 of your taxpayer funding today to bring benefits sooner today. So just also thinking about how that engagement of agencies and experts in these larger bureaucracies is super important for community benefits. At the end, part of the reason there is engagement fatigue is because communities tell us over and over again what they want, what they need, what kinds of communities they want to see. We know they want the planting efforts. We know they don't want us to pollute their neighborhoods to death, right? So how can we deliver on that? And part of that is who's already at the table and what resources already exist, and how do we realign those resources to achieve higher health equity goals?
Absolutely. Thank you, Kizzy. Yeah, and I think that's something we've heard when we've had conversations with folks about particularly how to frame the community engagement chapter. That, you know, being project-based is not always the most effective of saying, like, we want to work on this one thing that we happen to have a budget for right now.
Yeah.
When actually we've been hearing from communities for years about what's important to them.
Yeah.
And there's a lot to act on very immediately.
Yes.
So I also want to touch upon something that I saw this in the chat a little while ago, but I think it's important to call out very overtly that, you know, we all know that there's been just such dramatic experience at all levels of government, of kind of neighborhood experience, household experience, in terms of how COVID-19 has impacted us. And we've also started to see like some amazing like innovations happening and resilience happening and kind of continued challenges. And I'm just wondering, as we are kind of, we're working on the draft of the updated active design guidelines right now, are there any particular takeaways or learnings or even opportunities that you see from this moment that can really drive home the reason why health is so important and what the resources are that we have at our fingertips?
One thing that I'll share, and I just saw Tamara walk into the room. She and I have been a part of a group of researchers that have been doing some research over the summer, which isn't quite public yet, but I was honored to support it financially right when COVID hit, to survey folks in key neighborhoods across New York City to ask them, how in this moment, right, when this pandemic is going on, how are you interacting with spaces outside of your house, apartment, room, things like that? And what are the barriers that you have, right? So that information, the survey that they kind of put out across the city, the responses that they were getting was that in specific neighborhoods, folks, their desire to interact with nature increased during the pandemic, right? And like, we know why that is, because we are all in this pandemic together. We are, isolated in spaces. We want to connect with places and spaces that are beyond ourselves in a lot of ways. But what was also interesting is a level of variation in zip code according to the number of barriers. So if you were in one zip code, you wanted to interact with nature, but you didn't have that many barriers, so you were interacting with nature much more. If you were in a different zip code, you wanted to interact with the space outside, but you felt like there were barriers, right? So then the follow-up question was, what are those barriers? Some of it obviously was overcrowding and space, right? And so that goes back to, where is the equitable distribution of space and public space, such that in certain areas, when you are trying to engage with the outdoors, whatever that looks like, there are too many people in that place. But also the fact that folks felt a negative perception of using that space for a variety of reasons, due to over-policing, due to kind of citizen policing, so like not feeling comfortable with your neighbors and being in that space and public space, right? And as a kid of immigrants, we were very, very cognizant of the fact that we were brown people in a public space. And I grew up actually having to dress up when I went to public space, right? Because there was a need to be performative in some ways to be safe, right? So understanding those barriers as well, and understanding, what those pieces were, I think is something that can hang really well when we are thinking about where investments can go and where they should be going and where they could be going in this moment. The data is from a research team at the New School, and it will be public, I will say, probably in the next couple of weeks. Eric, I saw your question. So once it becomes public, we'll definitely, Tamara actually sent the link. So there's some public information around it. There's a lot more that they found. And so I think it's important just to highlight that point as well when we're thinking about space and public space and people's perceived ability to utilize public space.
Fantastic. Thank you, Neighbor. And thank you, Tamara, for sharing that preprint of the survey results. I'm super excited to dig in. All right. Anybody else want to have any reflections on kind of the COVID-19 moment? I know that it's been a big part of kind of dominating all of our work these days. And right. It's nice to kind of think through, like, what are some takeaways that are actually really valuable for how we frame our work moving forward?
Yeah, I would just, add to what Nooper was saying, the importance of public space and the importance of public space, particularly in neighborhoods that have been hard hit by COVID. And unfortunately, and this continues to be unacceptable, that it's the same neighborhoods over and over again that face the burden of any sort of chronic disease or infectious disease. And quality public space has become super important. Access to transit and not overcrowded platforms, quality housing, all things that we're advocating for in the ADGs, really can relate to the outcomes of COVID-19, I think, in a lot of ways. And they sort of relate to each other, just like in the ADGs, where we talk about the infectious diseases of the early 19th century and planning and design strategies to help mitigate some of those things. It's sort of, we're facing those types of things again with chronic diseases and now again with an infectious disease. So I think, we can, keep learning the same lessons. And I think now we have an opportunity and certainly the tools to change the outcomes in a more positive way.
I will just add quickly that I think for us, for me, the COVID-19 crisis being in a collision course almost with summer heat waves really showed us two things. One is we need to have a better handle on what is happening with our social infrastructure, right? Our libraries, our recreation centers, our parks, sure, like all of the places, and what condition are they in if we needed to surge in a certain way in order to keep people safe, right? The second thing, again, a broken record here, is we need healthy homes, right? The bottom line is that people want to go to the open spaces, yes, but at the end had to spend a significant proportion of their time indoors. And for those of us that don't have quality housing or have housing that is making us sick, that it actually is a baked inequity in there, right? So the city launched an emergency response program this summer to provide air conditioners, energy efficient air conditioners to low-income seniors. And that's just an example. It was really rapid response. It was a tremendous undertaking that took the work, a significant number of hours by a million city agencies, but it was really about trying to keep people safe at a time that we couldn't tell them, go to your public library because that's the local cooling center, right? Or even understanding where was there a place where we could actually have social distancing guidelines so we can actually work that out, like where are our recreational spaces that is in a park? And are people feeling safe to go there? Are they okay to hang out with their neighbors there? So I think COVID really tested this concept of government understanding of the existing conditions of the building stock and also our city-owned social infrastructure.
Absolutely. Oh, and I see Delma's making her way back in. I'm so happy to see that. I know she had some technical difficulties, so we'll bring her back.
I think there's one thing that I wanted to add, Suzanne, to that.
Please.
I think it's also important to really acknowledge the fact that the people that are presenting here and kind of where we sit and the need for allyship and solidarity beyond city agencies, beyond funders, beyond private organizations, right? So the Center for Active Design being its own standalone organization, right? Working in tandem with the health department, working in tandem with the mayor's office, working with NYCHA, having a funder, right? To push things around and be able to get folks behind it. And the idea that it is not just government that is going to do everything, or it is not just the private sector or the nonprofit circles that will do everything, or not that funders don't have the answers, that we need to be working together around all of this and continue to build our connections and collaborations around a lot of that.
Absolutely. And I would say that that's actually one of the reasons why the original active design guidelines took off so successfully, was because it was multi-sector, multidisciplinary. It was one of the major takeaways and lessons learned that we can get so much more done if we're not just functioning in our own silos. And that's why conferences like these are so amazing for kind of shaping the way we practice. I know we're down to the last few minutes. I just want to give a nod to a couple of notes in the chat. Commissioner Silver mentions that another thing to note for COVID is that people are rediscovering the value of parks and nature for healing, dealing with trauma, and connection with other humans, of course, safely. And that this is the one safe place we can gather is outside in our public realm. Tamara Greenfield also highlights streets, schoolyards, there's open spaces, and NYCHA, our waterfronts. These are critical public health infrastructure nodes that we want to remain invested in. I want to actually we probably only have time for one or two more questions max, but one thing that I think is a really important part of all of the work that everyone on this call is doing, and it's a really key orientation to how we're approaching the rewrite and the update to the active design guidelines, is this emphasis on social connection. We've all come through a very vigorous year, kind of just in terms of if you watch Twitter, you're going to be mentally exhausted, right? But there's a sense of divide and disconnect that's happening in a lot of places in our country. And at the same time, many people are talking about how, the fact that we've been homebound for a while, we started to build new connections with our neighbors. I remember being at a talk with Kizzy once where she mentioned that, you know, in a crisis, it's those interpersonal connections with your neighbors that's going to save way more lives than the government swooping in. So I just wanted to give a moment to reflect on, you know, we've obviously, the city has been through some very serious trauma around COVID-19, but there are opportunities for us to reconnect and heal and socialize safely, particularly in public spaces. And I just wanted to know if any of you wanted to reflect on something that might inspire us to kind of convene together as a community, as a coalition of advocates, as just like members of New York City, to kind of make change and foster greater health equity, social well-being. And
I'll share an example that I don't know if I can link it to the active design guidelines, but I can actually. I think I can.
I'll do it if you can.
So, you know, I moved into a new and different place about a little bit over a year ago, and I moved here for love. No regrets. I love my boo, but you know, I'm in a new and different spot. And when the pandemic hit, like, I was not connected to the space that I was in, right? And being able to leave my apartment and having sidewalks that were accessible to me, that I could walk down them and have space that I could be walking and someone else could also be walking at a safe distance, that we could say good morning, right? Like, that was literally because my boyfriend is an essential worker, so he's gone all day. I will have no I'll have no interaction with anybody. It was literally those people on the street that I would see on a daily basis that I would be like, good morning, how are you doing? In the area that I'm in, there's an aging population. And so those conversations throughout the months then moved into like, good morning, how are you doing? Do you need groceries, right? Then it turned into, good morning, how are you doing? I haven't seen you on the street in a while. Like, is everything okay, right? I'll say that if I were in a neighborhood or a space that didn't have that ability, I wouldn't have connected with people around me, right? Like, and I remember, Suzanne, the panel, because I think I was on that panel too, because he was talking about her neighbors, about being grounded in that community. And I'll say that, like, as someone who's newer to the place that I'm in, the ability to walk and be public in that space allowed for me to even just like build connections that, like, when the masks are off, I actually have no idea what they look like because I only see them with their masks on. But I know that so-and-so has a dog. I know that so-and-so has this colored mask. I know that so-and-so walks with a walker. And like, those are the ways that we were able to build those types of connection in a like very hyper local way, that like, if I were in a space that had no space for walking, no space for like interaction with one another, it would just all be moot.
Oh, I can't. Don't be looking at me like that, Suzanne. You guys are sick and tired of hearing about my neighbors who are wonderful and who, during this pandemic, when I was stuck abroad for months, they took care of my cat and used my apartment as their home office, right? And so I think part of it is, again, also remembering that aside from the outdoor space, it's also about knowing our neighbor, the person who literally shares your hallway, right? And I just feel like that is so important. You know, there was just, this pandemic has been so hard on everybody for many reasons. I'll stop there because then I'll cry and then that's not professional. But the point is, it has been really hard. And I think that understanding that the person that lives next door to you is encountering a similar challenge, or that you can actually meet their needs, even if you're remote, even if that meant like a delivery of food or a delivery of booze at the right time when they were feeling down. You know, it doesn't really take a physical, personal like interaction if you have been building that from the get, right? If you have been making an effort to know your neighbors and to offer help, and yes, of course, infrastructure helps to develop those interactions for sure, but also just don't forget about the person that lives next door and upstairs. Like, that's your tribe. It can be your tribe. It should be your tribe if you're moving into our communities.
Absolutely. Thank you. And Selma, I don't know if you're able to check in with us.
I'm on audio. Sorry for the technical difficulties, but I love that we're talking about our neighborhoods, and I can talk about, living in Jackson Heights. That was the epicenter in March and April, and kind of the insanity of listening to what was going on in the neighborhood and feeling that very, very closely, and then the whole journey of it all, and now where we are now, where we have a very, very active open street that we advocate for to remain permanent, and being engaged in that neighborhood activism at the very local level. Working at NYCHA, sometimes it's like it's a little too high level, but then coming home and being like, oh, I can advocate here too, really empowers me as a person, and I think helps me do my job better every day. So
fantastic. And I know we're at time. I want to be respectful of the next session. Josh, any closing remarks that you'd like to offer?
Yeah, I think the connection to the neighborhood is great, and I think that's really what we're trying to accomplish with some of the strategies that are in the ADGs, and just connecting it with the research and the health outcomes. People sort of don't always necessarily understand that. Yes, if I know my neighbor and I see them every day, it does have an impact on my mental health outcomes. It has an impact on my stress and anxiety because I'm familiar and I see the same faces over and over again. It does link to longer term health outcomes. And so I think one thing that we really hope to accomplish with the update to the ADGs is that, we sort of take for granted some of these things that we see every day. And I think the pandemic sort of helped highlight those things and really reiterated that the design of our built environment really does have an impact on our physical health, but also our mental and social health. And so we're hopeful that we'll get this accomplished within the next 6 to 8 months. If things don't really go crazy, we're hoping not. But thanks. Hopefully everybody submit some projects that we can include in the ADGs, and we look forward to working with a lot of you over the next couple months as we finalize this. So thanks everybody.
Thank you to the speakers. Thank you to everyone who joined and shared ideas. I'm capturing as much as we can, and look forward to continued collaboration. Take care, everyone.
Bye.
Thank you.
Bye-bye.